Hi, Dr. Shook here. Today I want to talk about something that we commonly see with Hashimoto's thyroiditis. What we look for initially, most patients have not had thyroid antibodies checked, and we typically will screen patients using something called a comprehensive metabolic panel. This panel is a very expanded blood panel that lets us survey your physiology and look for a lot of potential problems. But included in our thyroid portion of that panel, there are about 10 markers, 10 to 12 markers. It just depends really on what I decide based on your history. But we look at TPO antibodies, which is thyroid peroxidase, and we look at the binding globulins, thyroid binding globulin antibodies. Those antibodies, if you have antibodies to those things, it means that you have Hashimoto's. Now you could have euthyroid Hashimoto's, which means that you're asymptomatic. Your TSH levels are normal, but you have an inflammatory autoimmune condition that is considered Hashimoto's. You don't have to have Hashimoto's thyroiditis where there's an increase. You don't have to. There's a few different ways that we can describe Hashimoto's. The first thing we do is we look to see, are there antibodies to the thyroid? If we have antibodies to the thyroid, the next thing we want to do, because we know that autoimmune conditions are expansive. So an expansive autoimmunity means that if you have lost self-tolerance and your immune system is attacking your own tissues, you are likely to have other tissues that are being attacked that you are not yet aware of. So what we do is we order Array 5 through Cyrex Laboratories. That is a multiple tissue autoimmunity panel that surveys your entire physiology. It surveys your blood, not entirely, but it surveys a number of tissues. I think we're 24 or more tissues. And what we look for is we're looking for where else is this autoimmunity. And so what we'll tend to find is that someone that comes in with an autoimmune condition, they will have other symptoms. And those other symptoms are typically not really recognized, but you know that they're there. Like you might have some joint pain or have low blood pressure, or you may even have some issues where you're not digesting your food that well, but you just, you know, it's not something that is bad enough that you're actively seeking treatment for it. But once we survey in your physiology, we ask you those questions on your history, we pick up on those things and we start to put this puzzle together. So when we order Array 5, what it shows us is, do you have antibodies to these other tissues? And so, for example, if your blood pressure is low, you could have some antibodies to your adrenal glands. Your adrenal glands are essential because they sit on top of the kidneys. What they do is they help with the regulation of your blood pressure. So if they're being attacked by your immune system, you could be developing some Addison symptoms, which is like Addison's disease. It's a disease of autoimmunity that relates to, well, basically your inability to produce cortisol, which those glands make. So we're looking for these antibodies to other tissues. Like say your joints may hurt some as well, and so maybe you have some antibodies to your cartilage, rheumatoid-like symptoms, or maybe your inability to digest your food properly is actually because you have antibodies to some of the cells in your stomach that make your stomach acid. So we start to find these other things, and we want to know what else is going on with you, because we need an overall picture of what's happening. What we do, the problem with conventional medicine is that autoimmune conditions are not diagnosed until there's visible tissue destruction. So if you have rheumatoid arthritis, you're not going to diagnose it until there's joint deformity. Or if there's Addison's disease, or if you have antibodies to your adrenal glands, that's not going to be diagnosed until your cortisol is flatlined, more or less. Basically, what we want to do is we want to look at these predictive antibodies, and that's the key word, it's predictive. So if you have antibodies to a tissue, that is predictive of future organ or system autoimmune attack and possible failure. So we want to know, what else is your immune system attacking? When you've got one autoimmune condition, very likely autoimmune conditions are expansive. If you don't have it now, you will likely have it in the future. So it's very important that we know what's happening now. So we'll get Array 5 to better survey your physiology and know what else is happening. That can be very important for your treatment, for us to support your health properly. So that's one of the places that we start, and I just wanted to clarify that and share that with someone that is interested in having someone work with their autoimmune thyroid condition. That's one of the reasons that you want to have that test done. I'm Dr. Shook. I hope you found this informative, and I appreciate you taking time out of your day to learn more about your health. Have a great day.